Many of the doctors I have spoken to here have told me that the founding principles of the NHS have, in their opinion, been betrayed by politicians. There was no democratic mandate in the election of 2010 for all these changes in the NHS. In fact, the government is using choice and the austerity argument to push through massive programmes of hospital closure and at the same time privatise what is left.
I can only speak from my personal experience, but in my experience, the objectives and the targets come first. I've seen that again and again.
I suppose you have to ask the question, did I ever believe those promises in the first place? And because, remember, I've been working on the NHS since the very early 1990s and privatisation. This is the very last piece, which is the abolition of the NHS, but in order to get there, it's taken them 20 years of steady dismantlement. The only thing that was left in place was the Secretary of State's duty to supply and secure healthcare for all, and also to distribute the funds according to need. That's the last piece to go.
Under the culture that's been operating in the NHS probably for the last decade, it has been unacceptable to admit that you don't know, that you've made a mistake, that you took a risk that didn't pay off, or that the system simply isn't working. What you're required to do is say, everything's all right here, and then go away and fix it.
What direct effect these kind of betrayals have on your patients here in South East London?
Well, I've lost count of the examples of patients where I've sent them in either to casualty or they've been admitted, and I've been quite shocked when they've been discharged or sent home. Many examples of poor assessment in casualty, many examples of premature discharge from hospital. I can only assume the clinicians at the other end are either frustrated or have no capacity or having to make decisions which they're not entirely happy with because of lack of resource.
And does the burden of that patient's health then come back to you?
Of course, I feel let down myself. I feel very sorry for the patient. I feel that our duty to the patient has been failed, and it destroys any job satisfaction that you may have.